In the previous lecture, we listed some public policies that seemed incompatible with the utilitarian framework. Here is the list. I want to examine some of these examples more carefully and ask, does a utilitarian really have to reject these policies? Given the discussion in the first part of this lecture, can the utilitarian accommodate these policies? And how would such an accommodation proceed? Let's begin with patient self-determination. In particular, let's consider the patient's right to withdraw from treatment. Of course, the utilitarian would not use the term right. Instead, the utilitarian might have to rephrase this as, respecting the patient's decision to withdraw from treatment results in more good than otherwise. It maximizes the good. But if withdrawing from treatment is contrary to the physician's recommendation, a withdrawal would presumably result in a worse health outcome. So how could complying with the patient's decision to withdraw have more good than bad consequences? There are two things a utilitarian could point to. First of all, the utilitarian could point out that the good should include physical as well as psychological well-being. Withdrawing from treatment might result in lower physical well-being, but not allowing the patient to withdraw might result in lower psychological well-being. The second point the utilitarian could make is that without a policy allowing patients to withdraw from treatment, some patients might not agree to be in any treatment program at all, for fear that they would then be stuck in that treatment program. And so, by having a rule or policy to respect a patient's decision to withdraw from treatment, the result is more overall or total good, since more people would agree to treatment, even though in some particular cases, respecting a withdrawal from treatment results in less good for the patient. Let's examine how the utilitarian might reconstruct other so-called rights. Consider the right to life. What that right could mean, according to the utilitarian, is that people should not deprive you of life. Consider the right to property. What that could mean, according to the utilitarian, is that people should not interfere with your selling, donating, or destroying things you own. Well, consider the right to privacy. What that could mean, according to the utilitarian, is that people should not acquire certain information about you without your permission. A utilitarian might try to accommodate all of this by claiming that a policy that prohibits such deprivation, interference, acquisition results in greater overall good. For example, suppose someone owns a great work of art and proceeds to destroy it, claiming that he can do whatever he wants to do to this object because it is his property. Our utilitarian could nevertheless say that even though the destruction of this work of art is bad, the policy or rule that we should allow people to do whatever they want to their property, in general, results in greater overall good. If any of this isn't clear, please post your questions in the discussion forum. What emerges here is a distinction between two very different kinds of utilitarianism. A distinction between act utilitarianism and rule utilitarianism. The act utilitarianism looks at the consequences of a particular action or decision. For example, what are the consequences of respecting this patient's particular decision to withdraw from treatment? Or what are the consequences of letting that person destroy this particular valuable property? The rule utilitarian, on the other hand, looks at the consequences of a general rule or policy. For example, what are the consequences of a general rule or policy that respects a patient's decision to withdraw from treatment? Or what are the consequences of a rule or policy that lets people destroy their valuable property? Thus, for the act utilitarian, an act is ethical if it results in the greatest number of good consequences. Whereas for the rule utilitarian, an act is ethical if it is an instance of a rule that results in the greatest number of good consequences. I hope you can begin to see how act utilitarianism and rule utilitarianism could have an ethical disagreement. A rule could have good consequences in general, though there could be an occasion where it has a bad consequence. Think of the rule, always keep your promises. The act utilitarian would say that in such a case you are morally obligated to break the rule. The rule utilitarian disagrees, claiming that following the rule is good, even though it sometimes has bad consequences. Tell me what you think, and use the forum.